In the field of trauma, obviously, you're oftentimes meeting people on the worst day of their lives, dealing with things that are unthinkable. And interfacing those difficult relationships takes a rare sort of communicator. And that's what Chris was able to do. When patients and their families are asked to understand the incomprehensible, he's able to put the message in a way that it can be received, they can understand, they can move in through the process of what's the next step in their care or the grieving process, unfortunately, if that's the situation. To have his presence there has been invaluable to the trauma team.
I've been in this work for 20 years publicly, 15 years again, starting into the 15th year with collaborative partnership with UofL Trauma Institute and UofL Health. And to be quite frank with you, I would have never imagined that my life would have evolved into these spaces to help get a message out and equally have a long-going relationship with so many people at the hospital that have been, to be quite frank with you, really good to me.
Chris's tools are really his mind, his voice, his heart, and his hands. And that sounds sort of silly, but that's truly what he brings to the table in a way that we all have these tools, but most of them don't use them like Chris does. He serves as an excellent representative to bring a voice to many patients in our region that don't necessarily have a voice. He brings attention to issues that may not otherwise be addressed if he weren't there to bring attention to those issues.
It's about caring. It's about, when requested to do so, either by family or by the Trauma Institute staff, to come and at least lend a hand in dealing with those who've been affected, especially as it relates to the unfortunate violent crime situation for so many years and for far too long.
And the one thing about Chris is he has always and will always be there. If he says he's going to do something, he will do it, whether it be for us or more importantly for our families of our patients and our patients themselves.
How do you turn down the family that requests your presence? How do you turn down the relationship you built with the Trauma Institute? It's about people trying to lean on you to get some kind of encouragement, some kind of strength, and asking you to be a pillar for them to hold on. It's just hard for me to turn people down when they request. I mean, that's just me. People don't understand that, that's fine, but that's me in a nutshell.